Thank you very much, Tim, for that very kind introduction. Just call me St. Wendy. When I learned about the mission of the Huffines Institute in trying to bridge the gap between science and the community, I wanted to gear my talk around that. So the first part of it, I'm going to talk about some of the public health recommendations that we have for how physical activity can improve bone health. But then I also want to introduce to you some current research going on, and some of the animal research actually, on which our human recommendations are based, because we know a lot more at the basic and preclinical level that hasn't yet made its way up to the public health recommendation stage, where we don't have enough evidence yet to say if you do this, it's going to improve your bone health. But I think I want to give you some insights into what's coming down the pike in novel research on physical activity in bone. And because we have a nice small group here tonight, we can make this very informal. So if you have a question as we go, you don't have to hold it to the very end. Just yell out a question, and I'm happy to deviate from whatever I'm talking about at the time. The first thing I wanted to start out with is to get you on my thought waves of how I think about aging. If you wanted to draw a curve that would describe ideal aging, think about how you would draw that. This is how I would draw it. We would maintain the highest level of function, whatever system we're talking about, cardiovascular function, muscle mass and strength, bone. We would maintain that until the day that we die, and then we would lose it. Well, that's not possible, at least not yet, but we can strive for successful aging. So successful aging, I would draw something like this, where we would achieve a high level of function at a young age. We would maintain that as long as possible. We usually have a slow rate of decline in most systems that start in middle age, late middle age. And at some point, this seems to be a trigger of aging, there's an inflection point at which the slope of the hill gets a little bit steeper. And that might be around 75 or 80 years of age, that the rates of decline in certain things begin to accelerate. Unfortunately, not many people in this country are experiencing what I would define as successful aging. I think we have a lot of people who would be under the umbrella of usual aging, which is not just the aging process, but it's aging plus the effects of disease, of obesity, of physical inactivity, and other environmental toxins like pollutants or these things that are in plastic now that we're worried about. And I think maybe this is even too idealistic a curve for usual aging, because of the increase in obesity and the marked declines in physical activity in the youth in this country. We probably aren't even achieving peak levels of biologic function at young ages. So our kids these days are starting out at a disadvantage and are likely to reach a point where they become disabled or not able to maintain a functional lifestyle into old age because they're not healthy. I think we're going to see that occurring at younger and younger ages. Now, when we think about bone health specifically, there are three ways that physical activity, or three times in life where physical activity is very important, and that's really across the full lifespan. The first time when it's very important is when we're developing our skeletons. And physical activity has been found to influence the peak level of bone mass that is achieved by kids. So kids who are physically active achieve more mineral in their bone, denser bones, than kids who are sedentary. The second time when physical activity is important is in adulthood, in middle-aged and young old age. That's when we start to lose some bone, and people who are physically active can probably maintain that better than people who are very sedentary. And then the final time when it's important is later in the lifespan, when we start seeing the true effects of aging kicking in, aging-related bone loss. And there, people who are physically active can probably not prevent that from occurring, but at least slow the rate of decline in bone. So with that as a background, as I mentioned, first I want to talk to you about the evidence-based medicine, how physical activity can prevent fractures and help preserve bone mineral density. And then I want to talk about some science-based theory about what the effects of physical inactivity are on the skeleton, what sorts of factors related to physical activity are most important when thinking about what sorts of activities you should do to maintain good bone health, and then talk about some novel factors that we're studying. I hope all of you know this, but in October of 2008, as a country, it was the first time ever that we had physical activity guidelines for Americans. First time. You know, we've had dietary guidelines for a long time, but for the first time in 2008, we have physical activity guidelines for Americans. I had the privilege of serving on the advisory committee that assembled the evidence report from which these guidelines were developed. So I have some insights into the background on how this happened. The guidelines are intended to provide science-based guidance to help all Americans from age 6 on up to improve their health through appropriate physical activity. If we condense these down to a few key guidelines, first one for kids, children and adolescents, is that they should strive to get at least 60 minutes a day of physical activity. And that should be moderate to vigorous aerobic types of activity. And at least 3 days a week, they should do some strengthening types of activities. And on at least 3 days a week, they should also do bone strengthening activities. And those would be things like running and cutting back and forth and jumping and any sorts of activities that are going to stress both their muscles and their bones. In terms of adults, do we have a question? The first key issue for adults is to be active at least a little bit. Avoid inactivity, because in certain areas like cardiovascular health and even premature mortality, the biggest benefit is apparent in going from very sedentary to just somewhat active. So it's very important just to have some level of physical activity, but then if you want more benefit to health, substantial health benefits, the guidelines now indicate that adults should get at least 150 minutes a week of aerobic physical activity, moderate intensity, or 75 minutes a week of vigorous physical activity, or some combination of those two that would be roughly the equivalent of that. If possible, you should try to accumulate this in episodes that are at least 10 minutes in duration and try to spread them out over the week. But really, to get the benefits, it doesn't matter if you do it just on one day or if you do little bits throughout the week. There's no evidence that those two will lead to different health outcomes. Another key guideline for adults is that you should try to do muscle strengthening activities also. The recommendation is that this should be a whole body type of exercise so that you're stressing different muscles, and that you should try to do this at least 2 days per week. When we go to older adults, and this was defined at age 60 and older, the recommendation, first of all, is just to follow the same recommendations for younger adults. But for those older adults who can't do 150 minutes a week of moderate intensity activity because of chronic health conditions, then they should be as physically active as their conditions enable them to be. And the other key piece of information from older adults, because falls become more prevalent and because falls lead to injuries that can lead to premature death, the other recommendation here is that they should specifically start doing activities that help to maintain balance. So activities like yoga or Tai Chi, or even some of the video games now. The Wii has a lot of games that help you work on balance. So those types of activities should be incorporated into the activity programs for older adults. Now, if you follow those recommendations, the evidence report that my committee generated would suggest that these are the benefits that you should be gained. For kids, there's strong evidence that you get multiple benefits, but the key one in terms of what we're talking about tonight is bone health. So that idea that being physically active can increase the peak bone mass that kids can achieve is very important. But there are multiple other benefits. If we look at the evidence in adults and older adults, there's strong evidence for multiple health benefits. Strangely enough, though, do you see anything related to bone on this slide? No, unfortunately not. And even when we go to moderate to strong evidence, there's nothing for bone. It's only when we go to the category of there being moderate evidence that we now see that there's evidence that we can lower our risk for fracture, and specifically hip fracture, and there's evidence that we can increase bone mineral density. So even though we've done a lot of research in this country, it has led to somewhat mixed results. And I think what I talk about a little bit later in my talk might give you a better indication of why I think that is. But for now, Sue.
Can you give us an example of what's considered strong versus moderate evidence?
Yeah, it's okay. The question is what is strong versus moderate evidence? And this is somewhat subjective, but it was the consistency and the strength of the evidence. So if there were studies, once we defined what the evidence base was, if all of the studies showed the same thing, then that would move it up toward the strong category. Or if the magnitude of the benefit was very large in most studies and there was maybe only one or two where it was less strong, then it would move up into that category. So it's a little bit subjective, but it came by consensus of the advisory committee. Another important aspect that came away from the Physical Activity Guidelines evidence report was the bottom line on the risks of being physically active. This was the first time I think this has been reviewed. So there's a chapter specifically on the risks of physical activity. And the bottom line here is that the health benefits of physical activity far outweigh the risks for most individuals. So even though we always say, make sure you check with your doctor before you go and do this, there's probably not as much risk associated with being physically active as we have thought. You should still check with your doctor if you have any concerns about your health status, but at least for doing moderate intensity physical activity, it's pretty darn safe. There's a caveat though, and the caveat is that the recommended level of physical activity, the 150 minutes a week, may not be enough to get you all of those benefits that I listed. And the reason for that was when we developed the evidence report that was fed into the development of the guidelines. This was done by health condition or disease or population. So I chaired the Musculoskeletal Health Committee, and I came up with a summary of the evidence that said this level of physical activity will